Setting up an IV line. IV fluids need to be given accurately and slowly to avoid giving babies too much fluid. Always use a micro dropper set. They deliver 60 tiny drops per milliliter and have a separate chamber to hold the required daily volume. Standard sets delivering 20 drops per milliliter cannot be adjusted accurately and can dangerously overload the baby with fluids. Here's how to assemble the microdropper set. Begin by opening the air valve for the chamber, then close the upper and lower clamps. Insert the pointed end into the port. Open the upper clamp and let in the volume of fluid you have calculated to give the baby. Close the upper clamp to stop the flow. Squeeze the microdrop chamber until it's partially full. Remove the cap on the end of the tube. Unroll the lower clamp to let the fluid flow through the tubing. Flush the tubing until all air bubbles are safely out. Then close the lower clamp. Keep the end of the tubing clean by hanging it over the IV stand. The common practice of putting a needle into the top of the IV bag can let in germs and should be avoided. After the IV has been started in the vein, plug the IV line into the cannula and slowly open the lower clamp to ensure flow. The fluid should drip easily. Remember, always use a micro dropper set. Keep connections sterile during setup. Flush all air bubbles out of the line.